hours. We have a chapel, just it's good to point out for parents. It's good that they love that. Now let's go this way. Sorry, it's getting dark. This is just up here, it's just more offices, but we do have, sometimes if they want to see, it's locked today. But we have our classroom in there if you want to, it's just a big lecture hall. It doesn't look any different than others, but sometimes they want to see it. So downstairs our second floor lab. Oh, yeah. So this was also here, but it just was like dingy, ugly. So this is just updated, remodeled, kind of looks like a hospital unit would look. So up here, they're gonna learn a lot of their skills. So in health assessment is during their sophomore year before they go to clinicals. This is where they're gonna learn to do head-to-toe assessments, vital signs, IV starts, NG tubes, all sorts of things they're gonna learn in this environment and practice in this environment. So there's, I don't know, 1, 2, 3, how many beds are there? 4, 5, 6, 9 beds, areas that they can practice. They're in pairs and partners and they practice all that here. But we can go in here. This is a brand new space. It's the same thing. We just expanded though. This was part of our computer lab. So feel free to have a seat because we can just kind of sit here and talk about things for a few minutes or things that I'd like for you to point out about the College of Nursing. So what are you guys' majors?
Don't know.
Don't know, that's all right.
I'm the kind of journalism.
Okay.
Bio.
Bio to do, what would you like to do?
Pre-medicine.
Good. Excellent.
Undecided.
Undecided. Awesome.
I am political science on the pre-PA track.
Very good. Very good. Yes, I think we're going to have a PA program at some point. Yeah.
Nursing.
You are? What year are you?
Senior.
Oh, I see. So what's your name?
Grace.
Grace, what's your last name?
Siegel.
I know your name. So she knows a lot of this, so she can talk a little bit to this. So this looks way different, right?
Yeah, I haven't been in here yet because I'm in public health right now.
Yeah, so you will spend time now, but you can talk about what it looked like before and what it looks like now. It looks completely different. So you've done simulation.
Mm-hmm.
Yeah. So anything that you wanted to share about it from a student standpoint?
It was really scary, but super helpful too. And now that we have like so many different ones, like there's 3 downstairs, that'll be a lot more help because usually we only did 1 a semester, which is, or maybe 2, but that's not very much.
You're gonna do more
this
semester, or this year you'll do more, so very good. Well, nice to meet you. I don't know if we've met in person before. So I told the other group important, I think, that are key points to know about nursing, and one of them is direct entry, but I think most of the prospective students and parents that come here probably already know that. That's probably why they've chosen Creighton to come and look at, but just in case they don't know it, direct entry meaning when you apply, so when you're a high school senior and applied, and if they put nursing as their major, and if they're accepted, then they're in nursing right from the get-go. It's a little bit different than some other schools, mostly state schools or larger universities, where they go for a year or 2, then they apply to get into nursing. They're normally very, very competitive. They have very few spaces. So then they're left with the dilemma of, okay, I didn't get into nursing, now what do I do? Go another year, try again, change my major. So it's a big selling point. But like I said, probably most of the prospective students and their parents already know that by the time they get here. We talked a little bit about clinicals are done mostly junior and senior year. There's a few things they do now at the sophomore level, 2nd semester, that will be in the lab or kind of clinical-ish. But most of that's done during junior and senior year. Other things to say about nursing, you can still study abroad if you're in nursing, which is a little bit unusual. Nursing all over in all programs is it's really rigorous. They're busy, they have very full semesters. So most other nursing programs, it's not possible to do a whole semester abroad, but we have kind of worked things around and worked with arts and sciences and worked with the study abroad office, global engagement office is what they're called now, that they can do that. So we've identified 1 semester where it's the easiest. It's 1st semester of sophomore year. So you can still study abroad, so that's a huge selling point. We find more and more students wanting to study abroad every year. So that's important to say. But there's other like summer study abroad fall break, spring break. There's those opportunities too for students who don't want to be gone a whole semester. So a lot of parents particularly, but maybe some students will say, what's your state board pass rate? So this is a big thing too. If that, you might hear NCLEX, you don't have to remember what that's for by any means, but every healthcare profession, when they graduate, they have to take a test to make sure they're competent to go out and take care of patients. So our state board is called the NCLEX. So they'll want to know what percentage of our graduates pass on the first time. So ours is 91% pass on the first time. You can keep taking it until you pass it, but it's important. We want our graduates to take it one time and be done. So ours is 91. The state national averages are about 85-ish, so we're well above that. So that's a huge selling point. What else do parents and students ask, like about if you have nursing, students interested in nursing? Do they ask anything particular that you've always wondered what that answer is? Anything that you can think of?
Is their core like different? Yes. How different is?
Their core is probably a little bit different than arts and sciences. We have some of our nursing prerequisite courses like our chemistries, anatomy, physiology that we count towards the core. So, but our students still take theology, philosophy, literature, ethics, history. We still take probably all the core that arts and sciences takes, maybe just not as much. So I think there's 2 histories in arts and science, we take 1. So it's very much the same. So the core is first 2 years, and then we want them to be completely done with core by the time they're juniors because they're in clinicals then. So clinicals, for those of you that don't know what that means, they're in groups of 8, and they are with 1 clinical instructor, and they rotate through different clinical areas. We do a lot of what's called med-surg or medical surgical, and that's kind of an umbrella term that those that fall under that are a lot of patients that are sick in the hospital with no particular, lots of different diagnoses. It's just a big umbrella term. And then we have a lot of areas, specialty areas like labor and delivery, ICU, ER, OR, those type of things. Pediatrics, mental health. So they'll rotate either 3 or 4 weeks, 2 to 3 days a week through each of those specialty areas when they're juniors in first semester, senior year. Then they will go, their last semester is a preceptorship. So that's where they spend 220 hours, and I want you to remember that number, or just say over 200 or something. 220 hours with a bachelor's prepared nurse. That's a lot more than the programs that I find, which are probably about 100 or 150. So we have a lot more hours in our preceptorship. It's over 6 weeks-ish. So half the class will do it in first 6 weeks, half will do it the second 6 weeks, last semester, senior year. Then they switch. Though when you're not in preceptorship, you're going to be doing a lot of NCLEX or state board prep, a lot of simulation, a lot of practice testing. We have it's called ATI. It's an online learning product that our students utilize from freshmen on, but a lot of assessments done through ATI. Grace, you know exactly what that is. We wanted to do a lot of practice, so when they take that NCLEX, they'll be comfortable and pass it the first time.
Sorry, what's the CNA about?
CNA, Certified Nursing Assistant. So some programs make it required to be a CNA before they come into their program. We don't, because we're direct entry and they come as 18-year-old freshmen. We don't require it, but it's really great experience. We have students that get it in high school or the summer before they come as a freshman, or even they'll get it the summers in between freshman, sophomore, junior, senior. So it's a great experience. So they're nursing assistants, and you can work in all sorts of different clinical areas. It's a great experience for whatever healthcare specialty you want to go into. A CNA is a wonderful experience for that. So, yeah. We have graduate programs here for nursing too. So a lot of our undergraduates want to go on and become nurse practitioners, and we have that here. So just important for you to know that they can stay right here and go to graduate school.
How many nursing pre-med people do you have?
So we have a track, for those of you that don't know it, we have a specific track for students who might want to go on to med school, nursing pre-med track. So we have a lot that start off in it. So when I say a lot, we we enroll about 110 students every fall. And we graduate the same because we do take internal transfer students. So those that maybe will transfer out for a variety of reasons, we kind of backfill with students that want to come in. It's very competitive to try to get into nursing once you're here, but we do take some internal transfer students. So we have the pre-med track that we probably will have 25 to 30 who start off on it, and we probably graduate about 5 or 6 every year. And a graduating class is very rigorous. It's only a 5-year option. So, and that includes summers. There's no way anymore to get through it in 4 years. So it's 5 years that will take them, and it's a crazy packed full 5 years. So, but then what they have when they graduate, they have all of the classes that they need that are required for both the MCAT and for med school admission. They have those done, and then they can apply. They probably will apply before they even graduate and take the MCAT before they graduate, so. Yeah.
So they just have nursing as like backup, like why?
So a variety of things. It's so interesting to look at that. Sometimes students can't decide what they want to do, so they think maybe nursing, but they might want to go on to med school. And if you think about it, it's a great undergraduate degree to have to go into medicine. You've spent 4 years learning medicine, how to take care of patients, you've been in clinical areas, and then go on to med school. It's a great background to have. Most of the students, because I said we start off with probably 25, 30, most of them decide along the way that they like the nursing role. They want to be more at the bedside taking care of patients, and they like the nursing role more, so that's why they stay in nursing. But some of them use it as a backup. If they can't get into med school, then they have a great career in healthcare. So, yeah. What else?
Can you talk about the Encuentro program?
Yeah, so Encuentro is one of the study abroad options. So they can still study abroad that semester, first semester, sophomore year. So Encuentro Dominicano is in the Dominican Republic. So they spend a semester there, and it's not necessarily medical focused. ILAC,
No.
you guys know ILAC, Institute for Latin American Concern, is the one they can do between junior and senior year. It's a 6-week experience. They go with med students, dental, pharmacy, nursing, I might be forgetting one, PTOT, can't remember if they go. But you're divided into medical teams. You go out and you live with the families, and then you have clinic every day that you're there. It's really the only healthcare the Dominicans in those rural farming areas have, or once a year. So that's the ILAC. That's different than the Encuentro is the semester abroad. So that's one of the choices they can do for study abroad. It's not really healthcare focused, but it's still a wonderful immersion experience to go and live in a third world country for a semester. So
Minoring. Can students minor?
they can minor. So minors are an additional 18 credits. With the new core, which you guys, Grace, is anybody a senior? Grace is the only one that's in their old core now. But with the new core, it became a little bit more tricky to get a minor, but not impossible. It depends if students come in with some AP or dual credit. So it opens up some spots for them to fit in some additional classes. If they're willing to take summer classes, there's a couple minors where they can double dip into nursing courses, medical anthropology and health administration and policy. They can double dip, meaning that the nursing courses count for nursing and towards their minor. That makes it a little bit more doable, but we still have a lot of students who minor. I thought it would drop off considerably with the new Majas core, but we still have a lot that might, all sorts of things, Spanish. I have 2 dance minors of my advisees, business minors, health administration policy, medical anthropology, theology I've had business minors before, so they can still do that. So it's also a good selling point. What else? Any questions that you guys get from students or parents that you're stumped on, or